Good morning everyone, we're Code Vibers and today we present our solution for the problem statement Smart Community Health Monitoring and Early Warning System for Water-Borne Diseases in Rural Northeast India. Now to give a little brief about our problem statement, we have rural Northeast India facing a high prevalence of waterborne diseases mainly due to poor living conditions and a lack of personal hygiene. To address this challenge, we propose our solution in the form of an app and a web platform, each with their own unique features. To highlight some notable features, we have multilingual support that is tailored for diverse tribal languages in Northeast India. We have offline functionality that enables the app to have 90% of its features available offline and with the remaining 10% syncing when there is an online connection. We have AI powered prediction models that are predicting potential outbreaks in real time based on symptoms and water quality reports and seasonal trends. We also have heat maps that visualize outbreak hotspots on maps, giving authorities a clear view of clusters and enabling them quick responses like quarantine or resource allocation. We have offline educational modules on hygiene and healthy practices available in their own local languages. We also do water quality monitoring for rivers, lakes, and other water bodies that are basically drinking water sources for many cars. That is why offline functionality is so critical to the solution. There is also risk of incorrect reports from ASHA workers or community workers. That is why we provide a dedicated training module. There is also data privacy to handle that. All the information is end-to-end encrypted. Now let's talk about our technical approach. For machine learning, we are using TensorFlow, scikit-learn, and Prophet for disease prediction and seasonal trend analysis. The front end is handled by React Native for the app version and the React.js is building the web version. For the backend, we are using Fast API. The database we used is PostgreSQL and Redis for offline access and caching. The security is handled by JWT authentication and the notifications are handled via WebSockets and Value APIs for real-time SMS alerts. For deployment, we are using Docker and Kubernetes for scalable hosting. For the maps, we are using OpenStreetMap integration and the translation is handled by our custom-built NLP model. On feasibility and viability part, the technical feasibility is already we have talked about it. Now talking about the operational feasibility, we are rather leveraging the ASHA workers and PHC staff who require minimal training and is trained for what they are doing. We also align with government's IDSP protocol where hospitals must report epidemic cases. Our platform can act as a funnel, securely passing the encrypted data to the government servers without even storing it ourselves. The multilingual and regional adaptable support makes the adoption by hospital and staff members much easier. On scalability and cost efficiency, the system can be replicated in any rural areas across India and it can be extended to cover other waterborne diseases like malaria, typhoid. It is also cost effective since we are relying on the existing healthcare network and we do not need to create any new infrastructure to work with it. Now let's talk about the impacts and benefits. We have our use case diagram that is basically depicting how our system actually works. We have mainly three sources of reporting. There is users who are reporting symptomatic data from the app itself, and in case there is an absence of internet, we prompt the user to switch to SMS with the message being generated by the app itself. The user just need to send the message to our toll-free number that is given to us by our number service provider, and all the data first goes through a data transformer and checker that is ensuring the quality of data, and then it is being stored into the database. One of our main sources of data is the NGOs that are basically providing us with water testing results and reporting of diseases and symptom reportings. All of the data first goes through a data validator that checks the quality of data and the formatting of the data, and then it is being stored into the database to make sure the quality and the quantity of the data is securely passed on to the database. We have hospitals that are reporting disease reports that again goes through a data validator and we check the format of the data and the quality of the data, and then it is being passed to the SQL database. From the database itself, we are passing the data to the AI models. We have two models, one of them being the model that is mapping the symptoms that the users or the NGOs are reporting to the any potential epidemic diseases, and there is another AI model that is basically running all the time and providing us with real-time pattern predictions, and if it detects any unusual pattern in the reports, it will alert us with a system of potential outbreak. For the output part, we provide a dashboard to the authorities that is basically featured with geomaps by our map features. We provide threat detection and strategies to deal with any potential threats. We also have our alert system with two alerts levels that are basically authority alert and the user alert. For the authority alert, we have our geotagging map wise, area wise warning that will basically alert the authorities of any concerned areas. We have our strategies to deal with any situation, any problems. We provide a strategy to deal with it. For the user alert, that is basically controlled by the authority level to stop users from panicking or leaking of any confidential information. For the impacts and benefits, we have for social benefits, it is spreading awareness about hygiene and preventing practices through multilingual and education modules. For economic part, we are digitalization of medical records and creation of centralized healthcare database for long-term analysis helps immensely in the economic part. For strategic data benefits, we have heat maps and uh, that will help us in the time of need for quarantining or resource allocation of any emerging epidemics. Now we will move on to the prototype demonstration to showcase this lingual part. So now we can see the entire app is converted to Bengali, and the user can use the app in his or her own language. If we go to an article, we can see the entire article is now translated to Bengali itself, and the user can use the entire app in Bengali. Let me just first quickly switch to an institute account to show the institute. I have not changed it to Bengali. Okay, let me just convert to. Okay, let me just first convert it to English to display the features. Here in our home tab, we have our analytical overview that is basically showing cases today in the last 7 days, 14 days or 30 days. We are using demo data now because we do not have this many cases now. So to display the features, we are using demo data for now. Here we can see most affected zones. Here the alerts are shown in real time. Here we have our graph, disease distribution graph. Here we can see the spike in any particular disease if there is. Here we have our top alerts. We can click on show more. It will redirect us to the alert page, and here are the alerts coming in real time, and with each alert here comes a guide. Let me just click on one like increase hepatitis case. Here we have three type of guides like first steps towards prevention or preventive practices and knowledge practices. Each guide comes with each alerts. If we go to now the map part, which is a basically highlight, so the now the map is marked with the disease cases reported. Here are very few reports because we were testing the map before recording this video. Here we can click on any report and we can see in which area the report is from and in which which disease the AI model has predicted the symptoms to be. Here are few. We can just click on anything. It is a very primitive prototype, that is why the entire heat map is not shown, but the entire heat map will be showing in our website that is being built right now, because if we are constricted to a smaller screen in an app, and the entire dashboard will be coming to our website. For the water testings, we have a few simple questions that will be filled by the NGOs who are testing the data, testing the water bodies with manual water testing kits like pH, turbidity, color, odor. And if we submit the water testing result, water testing form, the entire form is being submitted to the history. Here we have a water testing form history that we have filled before recording this video. We also have the report page where the authority can report a symptomic case that is basically the same form as the user. So with this we conclude our prototype demonstration, and I hope you've liked it. The website is being built right now. The website will be much more dashboard friendly without the constraints of a smaller space, and I hope you've liked it.